Welcome to our podcast today. We're diving into essential tips for post-facelift care to achieve the best results. Let's get started.
I'm really interested in this topic. What's the first thing people should know after undergoing a facelift?
Well, the first crucial step is proper wound care. It's important to clean the incision sites with sterile saline solution to prevent any infection.
Right, so just gently cleaning the area, is that correct?
Exactly. And you should avoid putting any ointments unless directed by your doctor.
Got it.
Keeping the area clean and dry helps in faster healing.
Speaking of dry, should patients avoid getting the wounds wet entirely?
Yes, that's point number 2.
Okay.
Avoid soaking the incision sites, especially in the first few days. You can shower, but be cautious not to let water run directly over the wounds.
So maybe no swimming or long baths for a while?
Exactly. It's best to wait until your surgeon gives you the green light.
Understood. What about wearing any support garments?
I'm glad you asked. Wearing a compression garment or face support bandage is point number 3.
Yeah.
It helps reduce swelling and keeps everything in place as you heal.
How tight should it be? I imagine you wouldn't want it too tight.
You're right. It should be snug but comfortable. Not too tight to cause discomfort, or too loose to be ineffective.
Makes sense.
Adjust it as needed, and follow your doctor's instructions on how long to wear it each day.
Perfect. Now, I've heard about cold compresses after surgery. Is that helpful here?
Absolutely. Applying cold compresses is point number 4.
Okay.
It significantly reduces swelling and bruising, especially in the first few days post-surgery.
Are there any precautions to keep in mind when applying them?
Definitely. Use a clean cloth or ice pack wrapped in cloth, and never apply ice directly to the skin.
Right.
Also, limit each session to about 15-20 minutes to avoid skin damage.
Good to know. What about sleeping positions? Can patients sleep on their side?
Great question. Sleeping position is our 5th point. It's recommended to sleep on your back with your head elevated for at least the first few weeks.
That helps reduce swelling, I assume?
Exactly. It also prevents any pressure on the incisions.
Makes sense.
If you're not used to sleeping on your back, using pillows to prevent rolling over can help.
I'll keep that in mind. Now about medications. Any tips there?
Yes. Point number 6 is all about taking medications as prescribed. Antibiotics, pain relievers, and anti-inflammatory meds should be taken on schedule to promote healing and prevent complications.
And I suppose it's important not to skip doses even if you're feeling better?
Exactly. Consistency is
Right.
key. And always consult your doctor before taking any over-the-counter meds or supplements.
Speaking of supplements, are there dietary recommendations post-surgery?
Yes. Point 7 covers diet. It's advisable to eat healthy, nutrient-rich foods to support healing. Avoid spicy foods, alcohol, and anything that might cause inflammation.
So lots of fruits, vegetables, lean proteins?
Exactly. Staying hydrated is also
Got it.
crucial. Proper nutrition can make a significant difference in your recovery.
Now, what about physical activity? Should patients avoid certain movements?
That's point 8. Avoid strenuous activities and strong facial or neck movements like turning quickly or laughing excessively during the initial recovery phase.
So maybe hold off on the comedy shows for a bit?
Exactly. You don't want to strain the healing tissues or risk complications like bleeding.
Understood. When can patients resume exercise?
Point 9 addresses that.
Right.
Light activities can usually resume after a couple of weeks, but intense workouts should wait until about 4 weeks post-surgery, or as advised by your surgeon.
It's always best to err on the side of caution.
Absolutely. And attending all follow-up appointments is point 10.
Yes.
This ensures your surgeon can monitor your healing and address any concerns promptly.
I imagine that's non-negotiable. Missing appointments could delay recovery.
Exactly. It's vital to stay in touch with your healthcare provider.
Now, what about other cosmetic procedures after a facelift?
That's our 11th and final point.
Okay.
Procedures like Botox or fillers should be postponed until you've sufficiently healed, usually a few weeks to a couple of months post-surgery.
That makes sense. Give your face time to recover before adding anything else.
Exactly. And always consult with your surgeon before scheduling additional treatments.
Right.
They'll guide you on the appropriate timing.
Fantastic tips. But, I've heard some people say that wearing compression garments isn't necessary. What are your thoughts on that?
Well, while some may heal well without them, I believe the benefits of reduced swelling and support outweigh any minor inconvenience. It's a small step that can enhance your results.
I see your point. I guess it's better to be cautious and follow the recommended guidelines.
Exactly. It's all about achieving the best possible outcome.
Well, this has been incredibly informative.
I'm glad you found it helpful.
Yeah.
Remember, proper post-operative care is just as important as the surgery itself.
Absolutely. Thanks for sharing these insights.
My pleasure. And for our listeners, always consult your surgeon for personalized advice.
Great advice. Looking forward to our next discussion.
Me too. Until then, take care.